everyone, it's your girl Love to Smart Aaron, and today comes another episode of Beginning with Jesus. We learn and we end with a motivation. Alright, so our main text for the day is John 11:25, which says, Jesus said to her, I am the resurrection and the life. He who believeth in me, though he were dead, yet shall he live. Okay, let's zoom into our health talk for the day, which is understanding prostate cancer, its management and preventive measures. One may ask, what is prostate cancer? Prostate cancer is actually one of the second most common cancers found in men. It is a small gland responsible for producing seminal fluid. Now, it affects the prostate. The main cause of this condition is unknown. However, there are a few risk factors that contribute to one having such a condition. It mostly affects older men within the age of 60 years and above. Having a family history of cancers can also predispose one to having such a condition. Or it can also be inherited. Being obese is also a risk factor. Excessive smoking is also a factor. High intake of fat can also contribute to that, and also excessive alcohol intake. Now, there are some signs and symptoms that could manifest when they tend to have a weak and interrupted urination. There is painful urination, and also there is frequency in their urination, especially at night. They tend to have, in the advanced stages, pain at their lower back, their hips, and then their thighs as well. There is blood in their urine and semen. Now, early detection and screening is very important. So, what are some of the diagnostic tools we could use to help diagnose such a condition? A DRE is normally done, which is digital rectal examination. In this case, a doctor inserts his fingers through the anal regions to have a feel of the prostate and identify any abnormality. A blood test can also be taken to help detect for the specific prostate antigen that can cause this condition. We can also have additional lab values we could use, that is ultrasound, MRI being done. We can also take a biopsy as well. Now, the preventive measures we can put in place to help reduce such a condition is maintaining a healthy diet. Yes, it's very important. Including lots of fruits, vegetables, and whole grain can help to reduce this condition, the risk of having such a condition. Staying hydrated is very, very important. The treatment options we can use to help reduce this condition include active surveillance, which is very important. It is a team that is responsible for monitoring this condition to know the progress of it and how it advances to the late phase. We can also have a surgery done when it gets into the advanced stage. There is also a radiation therapy we use to help to reduce this condition. Chemotherapy is whereby the use of chemicals to reduce this condition. Hormonal therapy can also be done. Now, the radiation is whereby a high beam of energy is targeted on these cancer cells to destroy it. The chemotherapy is whereby effective chemicals are used to help target these cancer cells and destroy it as well.